Hello friends, welcome back in the channel of Clinical Care Insight. We started a series of lecture on dermatology, and in the first video we discussed about the basic overview of the skin, okay? And we mainly have to discuss the first disease that's called the acne, okay? And more specifically we will discuss about the acne vulgaris. Probably you all are aware about the term called as the pimples. Okay, so generally during the adolescent time, we developed, you can say, one mask-like structure over the face. Okay, but generally it's not limited only to the face. Sometimes it's spread to the shoulder area, neck area, as well as the chest area. Fine. So in this lecture, we are going to discuss about the acne vulgaris. So see the lecture outline. First things which we are going to discuss is the introductory part, as we discussed in our previous lecture, and then we will discuss about the etiology. Generally it's a common things in general population mind is that this acne is developed just because we are going to be adult. Okay, we attain the adulthood stage, and that's why we developed these acne. Okay, person have the puberty, and due to the action of, you can say, certain hormones, there is a development of the acne. Yeah, more or less the answer is satisfactory, but as a medical student, as a health you can say health staff workers, we have to understand their basic mechanism, okay, so that we can provide the treatment, we can assess the patients, okay, because sometimes this acne it's become dangerous. Okay, it's become dangerous when it comes to the psychotic patient. Okay, they generally what they did, they just, you can say, intensely pick the pimples, and they you can say rupture the pimples, and that's a really pathetic conditions. So we have to understand it in a medical point of view. Then we will discuss how this disease is, you can say, spread, fine, and what's their geographical, is there any geographical area where these acne vulgaris are, you can say, more established, or there is any area where this acne is less established, or is there any genetic relationship, or is there any, you can say, the geographical distributions related with this acne. So all these things we will discuss under the heading of epidemiology. Fine. Then we will discuss our main things that's called the pathophysiology, how this diseases arises, okay, and you can say how they disturb our normal skin integrity. Fine. Then we will discuss about the histopathological changes. The histopathology, mainly this disease is you can say related to the skin. Okay, is related to the skin, and you know that whenever it's disturbed the skin means it disturbed the tissue arrangement, so it disturbed the histopathology in turn. Okay, now, and at last we will discuss the two things which is crucial, very crucial to understand. The first thing is called as the history and physical examination, and at last we will discuss their management, their treatment. Fine. So let's begin today's lecture. Now see, acne vulgaris. This acne vulgaris is basically an inflammatory disease. It's a inflammatory disease which disturb the skin microenvironment, You seen in the previous lecture that there are layers present in the skin, fine, and skin have their appendages called as the hair follicle. Apart from that, there is presence of sebaceous glands, okay, and also there is a presence of sweat gland. There is a presence of the different cells which is, you can say, involved in the maintenance of skin. So mainly it we discussed already know that something called as the pliosebaceous unit. Pliosebaceous unit consists of the sebaceous gland, okay, and then there is the presence of one duct, okay, and that duct is involved basically to excrete out the sebum which is produced inside the sebaceous gland. It need to be go outside. but due to the arisiness of this acne vulgaris, there is a blockage in this transmission of sebum, and that's why people develop a different kind of acne vulgaris, or you can say the pimples. Fine, no problem. Now, as we discussed that it generally, you can say, triggered in the adolescent time, so commonly triggered during the adolescent time. And the things which we have to understand here is that we know that we possesses the general microbiota, or also referred as a microflora, which consists of different types of bacteria, fungi, and other species. Fine. So there is one species of a bacteria which reside on the skin and which is a part of normal flora. And the name of this bacteria, you should write it down. It's called as the Cunibacterium. Yeah, Cunibacterium acne. Cunibacterium acne. This bacteria, they are mainly present in the skin epidermis area, and in normal states they are not disturbing us, rather they are utilizing the sebum, they are getting the nutrition, and you can say mainly they contribute in the overall maintenance of the skin. Now you may thinking how, you know that not one of the function of the normal flora is that whenever a certain new kind of bacteria is coming to our body, okay, it will fight, the normal flora will fight with the external bacteria for the common nutrition, okay, and thereby they eliminate the external bacteria and maintain the normal homeostasis of the, you can say, body. Fine. So that's a useful, you can say, property of this Cunibacterium acne. But what happened during the adolescence time, we attained a age where we developed the secondary sexual characteristics, and you know that the secondary sexual characteristics, it is mediated by one hormones. Yeah, can you name them? Yeah, very good. It's called as the androgen. So androgen is the one hormone which is responsible for developing a secondary sexual characteristics. Fine. Now, what are the secondary sexual characteristics? The mistake, as you are seeing on my face, is a result of the secondary sexual characteristics. Okay, there is the enlargement of the chest, there is a broadening of the shoulder, there is the, you can say, changes in the voice, as well as in the case of the female, there is a breast enlargement. Fine, there is a development of the mammary gland. Apart from that, you can say muscles are more, fat are more deposit on the buttock region. Okay, and there is a pubic as well as the axillary hair growth. Fine, no problem. So these all are called the secondary sexual characteristics, and generally it starts during the puberty. It's start during the puberty. Fine. And when this hormone, the androgen, okay, when the hormones called as the androgen, it start, you can say, their secretion is in the massive amount. If their secretion is in the massive amount, then there will be a, you can say, blockage of this pliosebaceous unit. There is a blockage of this pliosebaceous unit. Understood? No problem. And as I said previously, that this is mainly affect the skin of the face. Apart from that, it's also affect the upper arm, trunk, and sometimes it's also affect the back region of our body. Got it? No problem. Now, what is the etiology? What's the etiology? The one thing we discussed that, okay, fine, there is a presence of Cunibacterium. Okay, Cunibacterium species, and this Cunibacterium species, they are also sometimes you came across in the textbook. They are also called as Propneobacterium. Propneobacterium. Okay, so don't confuse. This is the same. You can say the two word used for the Cunibacterium species. Okay, it's also called as the Propneobacterium. Fine. Now, So acne develops as a result of hypersensitivity of the sebaceous gland to the normal level of circulatory androgen. Okay, and this is the main one reason, but there are certain risk factors. There are certain risk factor. You know that generally medicine is used for you can say minimizing the symptoms, okay, and curing from the disease, relieving from the disease. But if you administer certain medications, they have the adverse effect as well. They have the, you can say, adverse effect as well. So the contributory factor, if we're talking about the contributory factor which enhance, or you can say which exacerbate these acne conditions, the one of the drug is like the steroids. Okay, steroids can enhance the acne. Apart from that, the streptomycin and anticonvulsant drugs. What are the drugs? Yeah, you should write it down. The one is called as the streptomycin. Yeah, this is the antibiotic. Streptomycin is the antibiotic. Apart from that, the steroids used. Yeah, steroids used. These can, and anticonvulsant drugs. Anticonvulsant drugs. These drugs is a neurological active drug. Anticonvulsant drug is a neurological active drug. So if you use the excess amount of steroid, or if you use the excess amount of anticonvulsant drugs, or if you use the excess amount of streptomycin, these drugs can lead to you can say increase the symptoms. These drugs increase the you can say symptoms, or it can increase the number of acne. Yeah, there are certain diseases where you have to count the number. Yeah, where you have to count the number, and acne is one of them. Acne is one of them. In this disease, you have to count, or if you have to consider the number of acnes. Okay, the number of acnes. Fine, no problem. Now, we know that generally the sunlight is very necessary for you can say overall maintenance of skin, isn't it? But if you expose too much to the sunlight, it can exacerbate, or it can, you can say, increase the chances to having the acne. Clear? No problem. And then there is a use of some occlusive wears. Occlusive wears refers to like the tight undergarments, okay, or you use the facial masks too much, or if you use the shoulder pads. Fine. So these things are called as the occlusive wears. So these occlusive wears can also increases the chances of having the acne vulgaris, or simple called as the pimples. Now there are certain endocrine disorders. Yeah, certain endocrine disorders. You know that the androgen is a hormone. Yeah, don't forget, androgen is the hormone, and you know that hormones are related with the endocrine you can say system. So if any endocrine gland, and you know that androgen is secreted, yeah, by what? Androgen is secreted by, yeah, very good. Androgen is principally it's secreted by the testicles. Yeah, it's secreted by the testicles. Okay, it is secreted by the testicles, and apart from the testicles, yeah, apart from the testicle, it is also secreted by the adrenal gland. Yeah, so secondary site of secretion of the androgen, first one is, you should write it down, it's your testicles, okay, and the second one is the adrenal glands. So there is the one disease, okay, which is related with the adrenal gland, and that is called as the adrenal hyperplasia. Yeah, that is called as the, write it down, called as the adrenal hyperplasia. Adrenal hyperplasia. This adrenal hyperplasia result into the secretion of too much you can say the androgen, okay, and thereby it increases the chances of having the acne. Now there are genetic factors. The one research, it shows that the persons in a family, if if ancestors have the acne, then there is a chances to have the, you can say, there is an inheritance pattern, there is a high risk factor because their genes are exposed. So there is a genetic predispositions here in the this acne vulgaris. Fine, no problem. Now, and there is one more research, and that's a surprising, that shows that says that if you eat too much lactogenic products like the milk, okay, curd, butter, yogurt, these are a certain lactogenic, you can say, product, and if you consume it too much, it exacerbate the symptoms and also it can cause the acne. Okay, but underlying mechanism is unknown, and but that's a you can say the population studies. Fine. Now, and apart from these, there is a psychological stress. So if you're taking the psychological stress during the puberty time and during the menstrual period, okay, so this can, you can say, you know that the stress hormones can trigger the adrenal gland to secrete the circulatory androgen in a massive amount, okay, in a larger fashion, and thereby it can again exacerbate the symptoms and also it causes the acne vulgaris. So these are the etiology. Once again, just quickly recap what are the etiology, what are the cause. The first one is normal circulatory androgen. Apart from that, if there is any endocrine abnormalities like adrenal hyperplasia, and also if you use the certain medications like the steroid drugs, okay, if you use the anticonvulsants medications, or if you use the streptomycin in a too much, okay, it all can cause the adrenal, it can all cause the acne vulgaris. Okay, the other is to wear some occlusive wears like sweater pads, okay, tight, you can say dress up, okay, mask. These all can cause the acne. And genetic factors, milk consumption and psychological stress are some of the related contributive factor associated with the acne vulgaris. Now, coming to the epidemiology, you know that this epidemiology is basically a study of the prevalence, okay, the prevalence of the disease. So as we discussed that mainly it's affect the adult young age persons, adult, or you can say the young adults. Fine. And there is one interesting you can say aspect related with the acne, is that acne is more common in the males, okay, than in the females. And in reality, the male sex hormones, okay, the male sex hormone is considered as the androgen. So maybe that's the one reason that androgen is more secreted in the male. That's why they are the they have the more risk factor associated with this acne vulgaris development. Got it? No problem. Now, apart from that, sometimes the post-adolescence, okay, acne are also, you can say, predominantly affects the female. Fine. Adolescent, remember, the adolescent acne more, you can say, affect the male, and you can say the post-adolescents, okay, post-adolescents more affect the females. Fine. And there is another you can say epidemiology, is that the urban populations, they are more, you can say, susceptible to this acne vulgaris, or they are more prone towards development of the acne vulgaris as compared to the rural population. Okay, and sometimes we will see the one type of the acne where this acne is developed in the neonates. Okay, so that's called as the neonates acne.